Hi everyone, my name is Mike Collins and this is my TED Talk. So I'm here to talk about healthcare in Qatar versus the United States. So we'll start off with the healthcare system classification. Looking at Qatar, they have universal healthcare with the option of private insurance. Their main medical or healthcare provider is Hamad Medical Corp, and they are their chief non-profit healthcare provider. And then going over to the United States for our classification here, we have a combination of public and private insurance. And then the public insurance that we have include Medicare and Medicaid, and then private insurance is however employers or if you go out of pocket and pay for that yourself. So the health of the population, looking at both Qatar and the United States, we're looking here at life expectancy. Qatar, for males, their life expectancy is right around 77.4 years. And then for females, their life expectancy is right at 79.9 years. And then for the United States, we see that males' life expectancy is 76 years. And then females' life expectancy is 81.2 years. So decently comparable between both Qatar and the United States. For total healthcare spending per capita in US dollars, Qatar spends just $2,030 per capita, which is a very low number. Spending in the future is actually expected to rise as a result of expanding population in Qatar, which is growing at a very high rate, and also the high incidence of non-communicable diseases such as cancer, lung disease, or heart disease. And as you can see here, they start off in 2004, sitting right around $8,000 per capita, and in 10 years, this data was taken as of 2015, so right around 11 years, you can see that it's sitting right now at $2,030, which is a great improvement for that country. And then for the United States, right now we're at $10,224 per capita of spending. And this spending is expected to rise due to rising costs for healthcare services, and also things like pharmaceutical spending, administrative costs, and just the cost of labor in general. So looking at emergency department visits per 100,000 people for both countries, Qatar is sitting at 39,571 visits per year per 100,000, population adjusted. The demand for emergency medical services is actually going to rise in the next few years due to, once again, earlier mentioned, their expanding population in Qatar. And also some of the increase in that demand is going to be from motor vehicle accidents, which has actually increased a lot in the last couple of years. For the United States, right now we're at 42,032 visits per 100,000. And this demand for emergency services is going to remain constant in the United States, so that number should stay right around there. So now looking at some smoking prevalence and tobacco control efforts that are going on in both these countries. Qatar has a smoking prevalence of people who are age 15 and higher at 15.89% as of 2015. So they obviously want this number to go down because of all the known health defects from smoking. So right now they're doing a smoking ban in public places. They're trying to prevent marketing for chewing tobacco and more recently electronic cigarettes, which are hitting markets pretty fast. And also they're preventing sales of tobaccos for products or tobacco products for people who are under the age of 18. And then regular tobacco awareness campaigns right now are happening at schools and universities. So this is a main point they want to keep going on in Qatar to try to get this number down for younger people who are hopefully seeing trends and seeing that it should be stigmatized to be smoking. And their overall goal in Qatar is to prevent the impact of smoking on young people and just increase the older people's chance of quitting if they've already started. Targeting young people is very important for Qatar right now, and yeah, that's their right now with the efforts of their tobacco and smoking prevalence control. And then for the United States, right now we're at a 14% prevalence, and that's age 18 and over from the year 2017. Tobacco prices are increasing right now, so that's one of our efforts that we're giving is to hopefully people will stop smoking if they aren't able to afford the cigarettes. Anti-tobacco mass media campaigns have been happening. That's always been prevalent, but it continues to be a thing here in the United States to try to get young people and people who already started to quit smoking. And then also smoke-free policies. A lot of universities have smoke-free policies, a lot of public areas here in the United States. That's another way we're trying to get rid of smoking. And then the U.S.'s overall goal is to reduce the prevalence of smoking among young people, reduce overall tobacco consumption, and just increase the quitting. Looking at the physical environment of Qatar versus the United States, Qatar has an average exposure to the general public of particulate matter of 2.5 microns, and they have their number right now is at 105 micrograms per meter cubed. And the United States is sitting at right now 8.4 micrograms per meter cubed. That's a huge difference right now in the pollution between both of the populations. And then just kind of talking about how dangerous particulate matter is. In 2012, 1 out of every 9 deaths globally was a result of air pollution conditions. And also, WHO guidelines have said that the average particulate matter should not exceed 10. And right now you can see Qatar is at 105, which that is a very dangerous number to be at. So that population should have some concern over their air pollution and hopefully some future prevention that could happen. And then according to the U.S. Department of Health, exposure to PM 2.5, the particulate matter, has a range of health effects, both short and long term. So this is actually a very major hitting point for this population. The United States is okay right now, but Qatar, obviously, from their numbers, they would love to reduce this pollution to help benefit the health effects of their population. Looking at unmet needs for drug rehab, Qatar has around 5%, or around 5% of the population has a substance use disorder. The country has many public facilities that do treat alcohol and drug disorders right now, but they do have some unmet needs, and some of those include they don't have addiction treatment for gambling and food disorders and internet disorders, and these are disorders that people have looked past, but they're actually prevalent and they should be met. And also, some unmet needs are the destigmatization of drug and alcohol abuse, and as a lot of those cases are going unreported right now, so there's kind of a stigmatization around people reporting them in the first place. And for the United States, we have an 8.1% of the population has a substance use disorder. Our country lacks enough facilities to treat these disorders, lacks enough facilities, and also trying to get people who are low income to have access to those. It's right now a challenge the United States is facing. So some unmet needs for the United States is we need widespread quality drug rehab facilities. Emphasis on quality, because a lot of times we'll put people through rehab and nothing will happen, nothing will come out of it. Unmet needs mental health, as that's stigmatized here in the United States. We haven't recognized a lot of co-occurring disorders, so a lot of people will have mental health disorders along with other things, and we'll try to fix one, but then you leave the other one untreated. And then also increasing rates of opioid addiction, as that's a problem that actually hits home close here in Columbus and in Ohio, as opioid addiction is negatively affecting our population's lives. So looking at unemployment rates, Qatar actually has the lowest unemployment rate in the entire world, sitting at 0.1%. That is due to a very wealthy population and a very tight-knit and small population, but once again that's growing, so we might be curious to see what happens to their unemployment rate as their population grows. And then the United States is sitting at 3.18 of their population is unemployed. And this rate is very average compared to the other countries, but living in the US, we would love to see this number go down. And also when unemployment rates go down, health outcomes for people go up. And then just defining unemployment rate is defined as the percent of unemployed people that are among the labor force. So people who are able to work and who haven't retired yet or aren't young enough they're still in school. So for the conclusion, talking about Qatar and the United States and looking at their healthcare systems, people living in Qatar and the U.S. have pretty similar public health quality for the most part. As life expectancy rates and smoking prevalence are right around similar rates, but there's obviously some disparities that we can see. First, one of them is that the physical environment of Qatar is sitting at a very poor number right now with that 104 particulate matter rate. So that's going to negatively affect their health effects, or negatively affect their health outcomes, and we want to see that. They would like to see that go down. And also, both countries have clear unmet needs for drug rehab, as they both have a pretty 8.1 to 5% of their population has a drug abuse disorder. So we want to see those numbers go down to help health outcomes. But a big difference right now is the healthcare spending in Qatar is significantly lower than the United States. This is due to their universal healthcare system and their smarter private insurances. And that number, as I said earlier, was $2,030 of spending per capita compared to the United States, which is $10,224. And then in conclusion, both Qatar and the United States do have room for improvement in regards to health outcomes to the general population, but Qatar's universal healthcare system is much more efficient and cost-effective healthcare system than the two, so that offers better health outcomes for more of their population than the United States experiences. Thank you.